The next section we'll go through is exploring calf mortality. I think calf mortality occurs quite commonly on many farms and is an area of opportunity that we can address. If we think about mortality rates in dairy calves, this is again from the National Dairy Study, which went out to 1,000 dairy farms and explored what the levels of mortality were. We have fairly high levels of pre-weaning mortality. About 6.4% of calves will die during the pre-wean period, and we have 2.5% of calves that die during the post-weaning period. So if we combine that with the calves that we lose, during the perinatal period from birth to 48 hours, we're losing about 15% of calves before calving. Okay, which I think is a significant issue on, from a consumer perspective or from a welfare perspective. Another challenge from a welfare perspective is also the proportion of calves that are euthanized. If you look at during the pre-wean period, only about 10% of calves are euthanized, and 90% will die unassisted. So I think it's important that we have informed discussions with our producers on when the appropriate time is to euthanize calves, because I think this is a significant welfare issue. How do we monitor it? I think it's challenging on some dairy farms because the records can be challenging. But with new pro-action requirements, you'll need to record all mortality that happens on farm, so it might become a bit easier. Our goal for pre-weaning mortality is to be less than 3%. And as you can see, this farm is achieving that. And our goal for post-weaning mortality is less than 2%. And this farm particularly is not achieving that. So the nice thing is when you're monitoring that, again, you can have informed discussions with your producers to talk about how can we manage what's happening in terms of mortality on farm. So, and also when you're monitoring it, you can identify when things go off the rails, like this particular farm that had a challenge in the pre-wean period in 2019. So the next question that you ask after you're doing all this monitoring for mortality is, why are these calves dying? And ideally, you want to do postmortems on calves to identify that. But if you think about how many calves had a postmortem completed, especially during the pre-wean period, it's very rare. Only about 3% of farms reported doing a postmortem on their pre-wean calves. So I think that's another area that we can motivate producers to start identifying why are these calves dying, so we can put particularly structured management procedures or practices in place to reduce that. So why are these calves dying? The majority of calves that die during the pre-wean period are due to diarrhea. About 56% of calves will die due to diarrhea in the pre-wean period. So not only do calves die from diarrhea, but they also have consequences if they survive. So if we have a case of diarrhea in a calf, we're going to have reduced growth, we're going to increase age at first calving, and we're also going to reduce first lactation milk production. We're also have the consequence of having labor and treatment costs. And what this black circle down here at the bottom is insinuating is a labor and treatment cost for the average Ontario dairy farm that milks about 80 cows. So about $1,300 just purely in labor and treatment costs, not even looking at any of these other consequences. So how do we prevent diarrhea? Really the biggest thing that we can do is have proper colostrum management. Feeding good quality colostrum quickly after birth can be really important to reducing the level of diarrhea that we see. Having good nutrition is also important. So having high planes of nutrition has been associated with a reduced level of diarrhea and also improved recovery from diarrhea. Using some vaccinations, so dry cow vaccinations to bolster the specific antibodies against E. coli, rotavirus, and coronavirus can be important, as can using some boluses that we give at birth. Those can provide specific antibodies, again, to those specific pathogens. And finally, ensuring that we have a clean housing area and we're feeding these calves with clean feeding equipment can go a long way to preventing diarrhea. There's also some building evidence or interest in using nutritional supplements to prevent diarrhea. So some of the newer work that's been done has been on colostrum replacers, probiotics, and also IgY antibody products. If we focus specifically on colostrum replacer, feeding about 70 grams of colostrum replacer in milk for the first 14 days has been associated with a lower level of diarrhea, lower level of antimicrobial treatments, and also improved pre-weaning weight gain. Looking at probiotics, there's been a meta-analysis which is pulling literature from multiple different papers together to look at the effect of probiotics. What they found is that when you're feeding lactic acid bacteria in the diet, it also led to a reduction in diarrhea in the pre-wean period. IgY antibody products, which are produced from laying hens where you vaccinate against E. coli, rotavirus, coronavirus, and then you isolate that egg yolk. Supplementation with this product led to a reduced level of diarrhea or mortality when evaluated using a meta-analysis. So there's definitely some work that's showing these nutritional supplements can help to prevent diarrhea and hopefully can reduce levels of mortality and also reduce levels of antimicrobial use that we'll talk about in a sec. So switching gears to respiratory disease, many calves die during the post-weaning period due to respiratory disease. So this is a significant challenge, and I think it needs to also be addressed. Also, if the calves survive a case of respiratory disease, they'll also have those challenges like we talked about earlier with diarrhea. So they survive a case of respiratory disease, they're still going to have reduced growth. They'll reduce first lactation milk production, about 600 kilogram reduction, and they'll also have reduced reproductive performance. And similar to diarrhea, if we just purely look at labor and treatment costs, it costs the average Ontario dairy farm about $3,700 per year. So how do we prevent diarrhea or respiratory disease? I think there's two main things that we can look at. The first one is the housing environment that they're in, and the second one is the vaccines that we're using on the calves. So if you look at housing, I think having an ample amount of bedding is really crucial. And if we can allow these calves to nest, like seen here, where their legs are not visible when they're lying down, it can really provide a crucial role in aiding in thermoregulation. So we can prevent these calves from being chilled, prevent drafting also, so that we can improve the ability of the innate immune system to work and prevent respiratory disease. Next thing is stocking density, and there's a long formula here, which I won't go into great detail about. But if we ensure that we have the appropriate stocking density for the environment, we also can ensure that we have good air, don't have high levels of ammonia, we don't build up humidity, and that can help to prevent respiratory disease. Ventilation is absolutely critical, and delivering air, especially with no draft, is really important. So using positive pressure ventilation can be really important to preventing respiratory disease. Ideally, in the wintertime, we also want to see about 4 air changes per hour to minimize ammonia buildup and humidity. The final thing that we can do to manage the environment is ensuring that we have proper drainage. If we have an inadequate drainage, we have the buildup of urine and other liquid that can lead to high levels of ammonia and humidity. So this may be a discussion, when barns are being built to ensure that we have proper drainage for all the liquid that's being built up. The other thing we can do to prevent respiratory disease is ensure that we have a good vaccination strategy. So it's important to note that, maternal antibodies, they build up over time from colostrum and then they decline. And it still takes a while for the calf's own immune system to start to build. So we have this window of susceptibility that occurs anywhere between 3 to 6 weeks of life or after birth. So what we can do is we can use vaccines or vaccination strategies to hopefully get us through that window of susceptibility. So intranasal vaccines are really a great tool that we can use to stimulate mucosal immune system, get that buildup of IgA, and really prevent infection from occurring because it's tackling at the level of the nostrils before it actually goes into the lungs. Some new research has also shown that following an initial intranasal dose of vaccine, it can actually lead to a better immune memory and more immunogenic response when we follow up with a parental or injectable vaccination. Intranasal vaccines are also not subject to maternal antibody interference, and they have a little bit of a shorter duration of immunity, about 9 weeks in total. If we look at some of the evidence that's out there for these intranasal vaccines, the majority has been on viral vaccines that cover BSV, IBR, and PI3. They've done challenge studies where they've challenged calves with those 3 viral pathogens, and what they found is that vaccinated calves were less depressed, had lower percentages of diseased lung, and higher oxygen saturation compared to those that were not vaccinated. So under a challenge environment, it shows that it works quite well. If we look at field-based studies, the field-based studies have found that there's no reduction in clinical disease, but they actually found a lower probability of consolidated lung when they're using ultrasound, which is really a significant result because if we have consolidated lung, it will lead to lower milk production and first lactation. Just to highlight the differences they found in that trial, so if they vaccinated with the intranasal vaccine, only about 41% of calves had lung consolidation, compared to the unvaccinated controls, about 77% had lung consolidation. So pretty significant difference there. Parental vaccines can also be used to aid in reducing respiratory disease, but the challenges in these young calves is that we have high levels of maternal-derived antibodies through colostrum, and those will bind and interfere with vaccine antigens. So we don't get an effective immune response to the vaccine. So the newest science is saying that we should wait at least 2 weeks minimum, and I'd suggest probably waiting a little bit longer than that for the use of parental vaccines. The challenge also with parental vaccines is a lot of the studies have been done on challenge models, which are not totally applicable to commercial situations. So that needs to be taken into consideration when we're thinking about parental vaccines. So at least 2 weeks minimum. I would suggest probably closer to 3 months minimum. So why are these calves dying? So the third most common cause of mortality in the pre-wean period is umbilical infections. And I think umbilical infections are really an underdiagnosed disease on many dairy farms. So if you think about the umbilicus, very vascular structure, that has a lot of blood flow going to it prior to birth and even after birth. And really, if we get bacteria that are going to the umbilical stalk, it's really a pathway into the rest of the body. So we get infection of umbilical arteries, umbilical vein, we get peritonitis, we get septicemia, a large number of different consequences. And here's just some pictures of what it looks like. So here's some momentum that's adhesed to the umbilical arteries, and here's widespread peritonitis that was from an umbilical infection. If we look how common it is, or umbilical infections are, they really are quite common. So these are from 2 different studies. One done in male calves, they found about 26% of calves had an enlarged umbilicus with heat, pain, or moisture that was present. And this study from the US found that about 27% of female calves had enlarged umbilicus with heat, pain, and swelling. So it really is a common occurrence on many farms, but I think, again, it's underdiagnosed disease. So how do we manage umbilicuses so that we can prevent umbilical infection? I think the most important thing that we can do is ensure that the calving area is as clean as possible. But the challenge is identified by the National Dairy Study is that many calving areas are not kind of perfect on many dairy farms. So if we look at some of the results from the National Dairy Study, about 83% of producers said they did not remove the calf within 30 minutes after birth. 11% used the calving area for sick or lame cows, and 24% never cleaned the calving area. So with the buildup of manure, and again, that umbilicus being really a pathway through the rest of the body, if we get bacterial infection that occurs there, it really can lead to some serious consequences. Other things that we can do is ensure that we have appropriate colostrum management, and also ensure that the housing area that we're moving these animals into is as clean and dry as possible. So again, we can prevent bacteria from entering into the umbilicus. So I'm sure some of you are asking, well, what about umbilical disinfection? I didn't really talk about that too much. And that's because there really is little that's known about the effectiveness of umbilical disinfection. What we do know is that there's really similar efficacy between 2% chlorhexidine solution and 7% iodine solution, but we really don't know if 2% chlorhexidine or 7% iodine is effective when we compare it to nothing. And it might not be without risk, so there's 2 studies that identified that there's an association between using umbilical disinfection and a higher prevalence of respiratory disease. So as a takeaway from this section, calf mortality occurs quite commonly on Canadian dairy farms. We have 6.5% of calves will die during the pre-wean period, and 2.5% of calves will die during the post-weaning period. It's really important, again, that we monitor this through producer records, and we monitor over time so we can identify when issues occur, and also doing postmortem so we can identify the specific cause of disease. If we think of the common cause of disease, majority is due to diarrhea, pneumonia, and also umbilical infections. And I think, again, if we can identify those specific causes, we can put specific management practices in place to address them properly.